without retraining the brain and strengthening of your neurology and changing of the biomechanics and changing of the habits in order to completely change the sensation and the patterns, you probably will never have a full resolution, and the amount of commitment that takes to get there, it's something. On this delightful morning, this sunshine enriched, beautiful Monday morning in October, that some would call Columbus Day, others would call Indigenous Peoples Day, others would just call a Monday morning like any other day. All right, so let's talk a little bit about injuries, reoccurrent injuries from compensating patterns, and what does that mean? So in the Gonstead Method of chiropractic, we talk a lot about the subluxation, right, where there's pressure on a nerve, and sort of like that primary area, a primary subluxation. Where's the primary area where we can adjust to get you a lot better, a lot faster, usually associated with getting out of pain or some kind of dysfunction. But then around there's all these like compensations. The way I think of it is compensation patterns when it comes to something like why a knee hurts, or why an ankle hurts, or why a wrist hurts, why an elbow hurts, why a different part of the back hurts that has nothing to do with the primary area. And that comes from years of adaptation. You know, sometimes months, but usually years of adaptation. So if you really think about it, your neurology, right, your brain and spinal cord has been getting used to these new patterns, kind of moving away from or making up for or trying to keep straight from that primary subluxated area. And this creates all these kinks and wiggles and grooves and, you know, biomechanical faults in your gait, in your movement patterns. And those aren't going to go away overnight. That's why we talk about always, you know, retraining with stability and retraining with mobility, progression flexion, right? My favorite thing to say a lot of the time, my new favorite thing to say is progressive flexion. Well, think of it being as progression towards, you know, getting out of these compensating patterns. And that's done through repetitive motion, proper exercise, you know, also adjusting these compensating patterns to re-trigger the brain, as I've alluded to in previous recordings. So think about that. A primary subluxated area, we can get pressure off that area and a lot of pain under control, like very fast. Like a few patients recently, it's kind of like, you know, considerably better. Oh, like how you doing? How you doing since your first adjustment? Oh, you know, 80% better, 70% better, considerably, like so much better, night and day difference. Cool, but I still feel it. Yeah, you know, takes time. Why? Because one, those compensating patterns are still there, and your body's gotten used to that, and now it's time to start changing everything around there, and or still address the primary area from time to time. Again, without retraining the brain and strengthening of your neurology and changing of the biomechanics and changing of the habits in order to completely change the sensation and the patterns, you probably will never have a full resolution, and the amount of commitment that takes to get there, it's something. So, you know, we have to pick our battles. More importantly, we have to understand why something's happening. All right, guys, I'm going home.